When the COVID operation was launched in 2020, we were told that a novel, never-before-seen virus had appeared on the scene, causing the deadly flu. The second lie was that there was a competent diagnostic tool that persists to this day. But that virus was never proven to exist. And while there are plenty of liars out there who will tell you that the virus for SARS-CoV-2 has been isolated and does exist, there's no real proof. And worse, science has been bastardized so as to gaslight the public into believing that it does exist. To this day, people still run to grab a COVID test at the first sign of a sniffle or fever, regardless of the fact that there is no validated instrument on the planet to diagnose any flu or differentiate one flu from another. Let's put this issue to rest, shall we? This is the Dr. Jane Ruby Show, and you're about to enter Truth in Medicine. Welcome to the Dr. Jane Ruby Show on this Thursday, October 9th, 2025. Well, for the past 2 years, Jamie Andrews has run the Virology Control Studies Project, managing 50 researchers, including peer-reviewed and published microbiologists, geneticists, and MDs. Together, he and his team have crowdsourced and open-sourced control experiments that analyze the virological method by contracting independent accredited laboratories to run experiments in an unbiased and industry-standardized manner. This team has come out to advise the world that the claims of isolation, which means proving the existence of the COVID-19 virus, supposedly responsible for the fake pandemic that drove millions to beg for a military-grade biological weapon, is 100% false. Yes, there was something that made enough people sick to convince you of the hoax, but it wasn't a virus. Remember, if you can't find the real problem, you'll never find the real solution. And I'm really pleased to welcome Jamie Andrews to the show tonight. Jamie, thanks so much for being here. It's really great to meet you and see you.
Hi, Dr. Ruby. Thank you for having me on.
Yeah, I was very intrigued by what I saw as your postings and the information. I spoke to some other scientists who have some great regard for the work and the project and your team. So let's kind of start out maybe from the beginning. How did this team get together? What is your role? What's your interest in it? And all that, just so people have a little context for what you're going to be presenting.
Well, I started the same as everybody, really, having a big wake-up call in 2020 when the world was, thrown into this strange boiler pot situation, and we were all trying to make head nor tail of it. Here in France, obviously, we were all in a bad situation, but in France we had a vaccine passport, so myself and my family were banned because we refused to take the vaccines. We were banned from civil society. We weren't allowed to go to sports stadiums, bars, restaurants, even soft play centers for my kids. We were banished from society, as it were. And so I really wanted to start and look at the actual reasons for why we were banned from society, for not taking something that they said was necessary to not get sick. And that really kind of led me, just as a layman. And now I have very little kind of scientific background. I did a geology degree from a decent university in the UK, but that was 20 years ago. That just let me analyze some of the science. It enabled me to be able to look at the data, look at peer-reviewed papers, and just have a look and see what was going on, really. And
Jamie, I wouldn't even apologize for that, but I appreciate hearing your background, because we've been duped by people with extensive credentials and degrees and things like that. So those days
Correct.
are gone. We just need people that are talented and understand and can bring more of the truth. So I didn't mean to
Well, that's it. With my endeavors, I've worked with a lot of people who have been in industry, and actually, the work that we've put out mostly has been engaged by the people who can see it. The people who can see from the industry insiders, because they're going, yeah, that's what I do. That's what Yet, for some reason, they haven't figured out that actually the things that they've been doing to quote unquote isolate viruses, and a lot of the protocols within in virology are what we have shown is incorrect. So I started to look at contagion. I started to look at actual person to person transmission, and it was jaw dropping to me that I was looking for the root cause. When you're looking for the basic principles of you sneeze and you give this virus to somebody else. And it was astounding to me that when I actually looked through a lot of the peer-reviewed journals, they were testing things all the way back into the Spanish flu era, and for 50 or 60 years, they were testing influenza by giving what they considered to be purified virus and putting it straight up people's noses. And the astounding thing is that people in general were not getting sick. It was not causing the disease which they were claiming during 2020, when people were being socially distanced, when they were being forced into wearing masks, when they were forced to be taking these interventions, when they were removing all of those basic things which they were saying was stopping a virus and putting it straight up people's noses. They physically were not getting sick. And this went right the way through to even COVID, where Nature, the biggest biological publication, admitted that they tried to give people COVID. And this is what it says in the title of the Nature publication. We tried to give people COVID and failed. They took what they considered to be purified SARS-CoV-2, put it directly up people's noses, and nothing happened. So this started to arouse my suspicion, and I started to actually look with a few friends of mine that I'd met through Twitter, that were all kind of standing just around looking at these things which were going on, in amazement. And a lot of these people were working in industry as microbiologists, as geneticists, and we started to kind of form what they were actually doing in these labs, because it was a bit of a mystery to me, and it helped me coming from outside of the industry, because sometimes when you're in the industry, you can be a bit kind of blinkered and be a bit focused just on you. The job comes in, you're told that you get given the set of things that you have to do, and then it comes out the other side, and that's it. You don't question, you don't go, well, is that actually? And for me, it was a good position, because I came at it with a kind of childlike in questioning, which was, what does that do? Why are you putting that in there? What does that mean? And actually, what I found was funny is that once I started to do these, ask these basic questions, everything kind of fell apart. It was one of those things that it was kind of like, well, why are you putting that in there? And it was, well, just because.
Sure. Because we always did.
If you didn't put that in there, would that still happen? And that was one of the big ones. And that's what the essence of a control is. If you did that and you didn't put a virus in it, do you still get the same result? And so this was set out by, and it's been going on for quite a long time, people that have been scrutinizing virology back into the HIV days. I mean, it goes back a lot longer than that. There have always been questions. Obviously, Béchamp and Pasteur were the first kind of fight, really. But questioning the actual existence after the mainstream narrative has been that these biological pathogens exist, really started to kick off in the HIV days. Again, with Anthony Fauci, that was his first big show, shall we call it? And there were a group called the.
Yeah, I'm sorry. I was going to say there's a lot of, and we'll get to the virology issue. But I get confused when I hear past tapings of Dr. Kerry Mullis, with the PCR, where he had, but forget the PCR for a minute, where he had those, disagreements with Fauci and saying there was no virus and that they made people sick with HIV and that it was the meds. And you have Judy Mikovits that comes in, talks about it, highly respected, talks about viruses like they're real, but is she talking about something else that they make in the lab that they call viruses by some kind of definition? So eventually I'd like you to get there, and I want the audience to understand that Jamie and I have talked about this ahead of time. He's going to come back very soon, hopefully within a couple of weeks, to do kind of a part 2 that'll be more in depth, and he'll walk us through those steps. But tonight, the intent is to lay out how he started this, what this is about, what he was trying to figure out once he learned all this. So, Jamie, I just wanted to kind of set the tone for the audience a little bit more.
Yes, yeah, that's it.
You've done a great job with how you got there and asking those questions. And I do, remember, in the audience's mind, it's like, well, what the hell? Is there a virus or is there not a virus? And like I said, something made us sick, but that could be a government gain of function. So, keep that in mind as you're explaining all this. I'm fascinated to hear what you think about those things.
Yeah, that's it. I mean, back from those HIV days, like you say, there was the similar kind of dynamics between some of the main players. Kerry Mullis developed the PCR test, and really what we saw through 2020 was an entire scamdemic, I would call it, based on the results of a fraudulent test.
Sure.
The tests that we have done using independent accredited laboratories have shown that the PCR test is not testing what it claims to measure. So,
big one.
That is a big one. And that's really been our direction of travel, is to make sure that 2020 never happens again, where they lock people down, where they try and remove informed consent, where they try and remove any sort of choice to what you put in your body, even if they are, heavily coercing it. I don't want to see that for my children or anything moving into the future. So, that was really the design of the Virology Control Studies project, was to get to the end result, which is the PCR. But there's a few logical steps before you get to that PCR, which is the very first isolation. It's where you have a purified single biological particle, which they call a virus. And back during the HIV days, there was a group called the Perth Group, headed by Eleni Papadopoulos-Eliopoulos, and she inspired a guy called Stefan Lanka, who also did these control experiments. We were talking about the premise that if you take an experiment and you don't put in what you're testing, yet you get the same results, that's a control experiment. It's a legally binding part of science. In fact, it's the only legally binding part of science if you do a control. So when you're talking about vaccine studies, you're talking about a placebo. So you're talking about giving saline instead of the vaccine. So you can test whether you think that it's the vaccine doing any good. I mean, I don't think vaccines can do good, but
Agreed.
if you see its effects, right? So you take a group of people and you give one group a placebo of saline and you give another group the test subject. Well, what we're doing in these, working with these laboratories, is essentially the same thing, but this all takes place in a Petri dish. So when they in vitro, sorry.
In vitro, yeah.
When the virologists look to isolate, they can't just take a virus direct from somebody. So if you have flu symptoms, they can't just take your sputum and then go, here's the virus. Apparently, they can't do that. They can do that with bacteriology, funnily enough, because bacteria exist. You
Right.
can see them.
And they're
You can
large.
see them.
They're larger than viruses
They're larger.
claim to be. Correct. So you need some exudate,
Smaller.
right? You need some exudate or something from blood. Yeah, I know that's where you're
That's
going.
right.
With it.
I mean, they say that you have to culture it. So they say that you have to use cells. So unfortunately, they cut them out of all sorts of places and they freeze them. These cell banks are clinical banks of cells, and they come from monkeys, unfortunately, from because scientists use all of these horrendously unethical things like aborted human fetuses, which are also in the vaccines when they're developing them, by the way.
Yes.
That they're using these cell lines from the kidneys of monkeys, from the kidneys of dogs and hamsters, and unfortunately people and fetuses. And they take these cell lines and they put a sample in, and they say they grow these cells out. And when a sample gets put in, they say, okay, well, these cells are dying because of a virus within that sample. And what Stefan Lanka did originally, and a few other people, and in fact, the very scientist who developed this idea of cell culture, John Enders in 1954, he did the same thing. He didn't put a virus in, what's known as control. So he took the cells, he took all of the ingredients involved in the cells, and he didn't add a virus, but yet the cells still died. And that's kind of a kicker, because to any logically minded person, to any scientifically minded person, you should say, well, if the effect happens, regardless of whether you put the virus in or you don't, then you're not showing that you have a virus, right?
Well, you're not. You can't attribute it to what you're calling.
No, you can't attribute it to a virus. And I explain it this way: if you took a banana in a bowl and you said, "I'm going to put some spit on the banana and go away and come back in 3 days," if the banana has gone black, that means that there's a virus. Well, we all know that if you didn't put any spit on it and you came back and the banana was black, it would be because it's just rotting fruit.
Right, oxidized, right, rotting.
So, and it sounds absurd. It sounds absurd to a layman, but that truly is what's happening. And we have shown this with independent, blinded laboratories, because again, I have no background in this whatsoever, but I have been running a scientific project and an experiment, and this is what I want to enthuse to people. We're in a world where we've got lots of information coming at us. We don't know what's up, what's down, what to trust and who to trust anymore. And you get these peer-reviewed papers coming from you left, right, and center, and health is important. It's probably the most important thing, right? And so I really wanted to enthuse being able, and it is perfectly possible, because I have done it, to reach out and conduct your own science. Now, that's what we did with a group of researchers. We researched the protocols, and we reached out to independent accredited labs who are just, you can hire them. They are for hire, just like Pfizer, just like Moderna do. They subcontract these laboratories. Obviously, they do it on a day-to-day basis, so they have working rolling contracts. But just as a layman, you can approach these laboratories. If you, obviously, they have a remit of what they can and can't do. But if you're talking their language, and that's what I did, for a couple of years, is just learn the jargon, really, look through all of the other virology papers and learn the jargon of what we were asking them to do, which was essentially conduct these control experiments by taking all of these things, but not adding a sample, not adding a virus. And we did that, and we did it in over 90 cultures. So we did it 90 times.
Right.
Yeah. So it wasn't just once, it wasn't just a fluke. And every single time we got the breakdown. So, and they call it something very specific. They call it the cytopathic effect. Okay. So they say that not only do the cells break down and die, but they break down with exactly the same look as if caused by a virus. So you have specific morphologies where a cell will be rounded, where a cell will lift off, where the cells will clump together, where the cytoplasm of the cells looks granular, where vacuoles, so holes in the cell line, open up.
Damage.
Exactly.
Cytopathic.
And they call this very specific damage. Exactly. And
So
We saw all of those, every single one of those types of damage in something which we did not put a virus in.
okay, so let me stop you there for a minute because I think it would be helpful for the audience to connect a dot here. The dot is, as another example, what they don't always understand is that all of these, vaccines that are on the market, every one of them, admittedly by these companies, has never used a benign placebo in whatever studies they did. They don't have to do full-blown proper studies. You're taking it right down the line.
No, that's right.
So share a little because they will use another vaccine material, like the MMR used another old measles as the placebo. I put in parentheses. That's not right.
I mean, they're always very wily with these things, because on the surface of it, and this is where you really have to go through the small print and go through the fine print, because when you look at any of these papers, when you look back through the contagion studies papers, the headlines will be completely different to the results, right? They will say, they're clever with their words. They will say, minimal transmission, or, we need to study a little bit more. But when you actually look at the results, it's zero.
Right.
And the same, like you point out with the controls, with the placebo-controlled trials, they will subvert the way that they claim that legitimate science is going on. Because let's not forget, if you do not, and like I mentioned before, the control, the placebo, is the only legally enforceable part of science where you have to have it.
Yes.
You have to have it to be able to certainly make a drug, or certainly. And so within virology, they do what's called a mock control, which they claim is what you would expect to be a control. So they claim that they are doing what we did, which is where you take all of the reagents and you do not add the virus, and it stays healthy and the cell line does not break down. Well, actually, when you look through the fine print of these virology papers, they never actually specify that they do it. They never give you the method. They never say that, and they're wily with it. They will take the picture of a healthy cell and say, look, we've done the control, but they don't tell you. They don't tell you this is exactly the ingredient list that we put in. This is the exact thing, and we treated them the same. They just expect you to assume legitimate science has gone on. So they're very canny with it. And
they tried to get away with it with, hey, our vaccine is 99% effective a month later. Well, maybe it's 83. Oh, I guess it's only 60. And there was a plan for that, right? There was a plan for that too, to introduce boosters, like within minutes, of getting the first one.
Exactly.
But this is why what you're talking about, Jamie, is so important. I want the audience to pay attention, because it might sound weedy to them a little bit, but if you don't pay attention to what Jamie's saying, you miss the whole point that they're slipping a fraud out to you. A mock control is fraud. It's total fraud.
That's right.
I'll let you get back to
That's right.
Thank you.
That's right. I mean, we've seen it coming from, actually, in a recent article that I've written with some help from a researcher. We have shown that these protocols which are causing this, because there's a bit of a technical aspect which we can go through at a later date, but the UN and the World Health Organization, who were obviously behind 2020, we all saw every single country working in lockstep together. They have written a manual that every single virologist around the planet has to follow these fraudulent protocols to isolate their viruses.
Wow.
Or they don't work. I.e., you cannot get accredited to be working in a virology lab unless you follow the manual which instructs you to basically carry out this fraud.
That's how the fraud gets carried out. Once again,
and so
feeding your family.
That's right. And so when you kind of get posed with that question, are they all in on it? Are they all working in lockstep? Well, yes, that is it.
That's
I don't blame a lot of these virologists for doing it on purpose. A lot of these people are my friends. I work with them, and they were never intentionally lying. But this is the kind of plausible deniability that there are, potentially tens or hundreds of thousands of virologists around the world, and they just get told what to do. They just get given these instructions, and that's it.
Stop at that topic for a moment. But now they know that what they're doing is fraudulent. If they're decent scientists, I wanted to say I'm a little harsher on that. Like the nurses that stayed behind in those big hospitals, they stayed for a paycheck and they enabled a system to continue to murder people. These virologists, by the same analogy, should know by now that they're doing it for a paycheck. And I don't know how they sleep at night. And maybe you want to speak to that, but I also want to mention, if we're talking about virology, forget virus versus no virus. There's a huge discussion out there about that virology is a fraud. If you can't isolate a virus and the government's making them at Fort Detrick or University of North Carolina, Ralph Barrick in his lab, they're making synthetic things that act harmful. They're antigens, they're synthetic antigens, they're pathogens, but you're going to call them a virus, then you get away with vaccine and all this other stuff. Then if you can't isolate viruses, you can't prove they exist. It's not just SARS-CoV-2, HIV. And people always say, because they're not really listening, Jamie, they'll say, well, what did I get sick with in 2020? You got sick with something. But just because you rule out that there's no virus,
they're using viruses as a scapegoat for industrial poisoning.
There you go.
Yeah. It's what they are putting in your food, what they're spraying in the skies, what they are spraying on crops, what is in your water. All of these things have chemicals, glyphosate and previously DDT when it comes to, the polio outbreak. You can map DDT usage, which is, a dangerous organophosphate chemical that they were spraying on crops. You can map it almost identically to the symptoms of polio. It's a neurological symptom. And so the state, the powers that be are using these viruses as a scapegoat for the poisonings that are going on in the supermarket. When you walk down the supermarket and you turn over, all of these products in there, the stabilizers and the E numbers and the coatings, the preservatives, and everything, everything that is put in the food that has some sort of chemical name to it is not natural, and it has to come out of your body somehow, and it comes out through these symptoms and these detox symptoms. So it's and when people go, okay, I've got sick, and nobody really disagrees with the way that people get sick. The mainstream and alternative healers all think the same. Is that if you drink a lot of alcohol, if you smoke, if you eat a lot of processed food, if you're stressed out, everything that they say affects the immune system, everybody agrees on that. Right. It's just that once you see it through the eyes of the fact that viruses do not exist, you just remove all of that, and the same thing operates. So,
did you know the biggest threat to your retirement is not something that's talked about very often? Our increased longevity in America means default retirement accounts like IRAs, 401ks, and TSPs may not suffice. If you've got over $100,000 in your retirement account, get instant access to a free 2-minute report from Augusta Precious Metals that reveals the one step you can take to secure your financial future. Visit goldwithjane.com. That's goldwithjane.com, or text Jane to 35052 today.
Looks like you've been sleeping well.
Megan, he's back. The My Pillow guy.
And you're looking good.
Still feeling good.
Well, just when you thought it couldn't get any better, we've got the best pillow ever, My Pillow 2.0. When I invented My Pillow, it had everything you'd ever want in a pillow. Well, now there's new technology that makes it even better. My Pillow 2.0 has my patented fill combined with a cooling fabric with temperature regulating thread. My Pillow 2.0 is truly the next generation of My Pillow.
Now's the time to go to mypillow.com or call the number on your screen. Use the promo code to save 50% on your My Pillow 2.0.
You're sleeping even better.
And cooler, too.
And you're looking good.
Feeling good.
I knew you would.
mypillow.com.
It operates.
So
The same thing happens.
if viruses don't exist, so virology is a specialty that is being used to defraud the public for medical pharmaceutical profit. Am I right?
It's for pharmaceutical profit, obviously, immunological. And as I say, it acts as that scapegoat to get away with saying, okay, well, it's not us that are, putting crap in your water or in your food or, that's responsible for that. Because, if people woke up to the fact that, cancer rates are skyrocketing and, all of these diseases, allergies and autism and everything are skyrocketing, then they would have to, and once these causal links come out that some of these things are being caused by the drugs and pharmaceuticals and things that are being put in our environment, in our bills, in our bodies, that there's hell to pay.
Yeah. Jamie, this is why I wanted you to come on the show. I'm so grateful. And why I think your work is and your team's work is going to be very pivotal and explosive to set this thing aside for the next time they may try to do this. I think they're going to do it in a different way. I've said non-compliance is not going to be enough the next time. But the point is, a lot of people understand that the governments and the pharmaceutical companies are married and that they've lied together. But this work is going to be so important because that argument of virus versus no virus, even with incredible people like Dr. Andrew Kaufman, who I've not yet met, but I love his work, the Baileys, right? And the two doctors, husband and wife from New Zealand, and there are other experts that have just escaped my mind, so forgive me to them. But because even with their expertise, it's just not enough. When I say they, it's the government and the pharma and the DOD and all that in the United States. Because that's where I think this crime emanated, I think.
Well, yeah. It's funny that you say about future, because I think that the future is not in virology. Funnily enough, like I don't think that they're going to do anything large scale with viruses because it's kind of run its course. What I think is a lot more scary to me is the open blank checkbook of oncology for cancer. So the recent maneuvers by people like Larry Ellison, who are from Oracle, who have come forward and said, look, we're going to be making these specific genetically tailored vaccines and drugs to give to cancer patients. They are now diagnosing cancer with the PCR. And as I said before, I have evidence that the PCR is fraudulent, that it does not test what it claims to test for. Now, obviously, through 2020, we had a lot of people, the president of Tanzania, who kind of came through and said that, the PCR test, he tested goats and Coca-Cola and engine oil and papayas, and they came back positive. And, he died in mysterious circumstances. Apart from that, there hasn't been a real thorough breakdown of it. And the conversations that I am having are pretty high level in terms of taking action against the PCR test specifically. And I think that that's really where the future, I think, is scary, because if people start to test wholesale for cancer, when they're going through dangerous chemotherapy based on a PCR test, I think that is incredibly dangerous. I think that because it's an open checkbook for the pharmaceutical companies, because, it's not just a $1 vaccine.
Yeah.
You know, you're talking, you know, chemotherapy is tens of thousands of dollars. So it's, you know, it's an open checkbook to them. If they can go around, imagine just like the silly little sticks, the LFT tests. Can you imagine getting an LFT test for cancer, and all of a sudden you're paying tens of thousands of dollars for a cancer that you don't have? You know, that is a real dangerous situation to be in.
It's hugely dangerous. The whole cancer thing, because I've said there was the stick and the carrot and the stick, you know, the punishment or the reward. What I mean by that is that with COVID vaccines, it was take this or you don't feed your family. That's the stick, you know, coercion. But this is going to be another way, very ingenious, to get people to run. I want that, you know, mRNA vaccine for my cancer, because cancer is a frightening diagnosis. You go blank, right? So yeah, that is a very good point you raise on the cancer issue. And the whole thing was a lie, because he said, we're going to find the particles in your blood. Well, let me tell you something, Larry. If you're finding cancer cells in someone's blood, that's not early. That's stage 4 by definition, right?
Exactly.
It's metastasized, idiot. Yeah. Yeah, very good point to raise, Jamie. And I'm interesting. I'm glad we clarified. You know, I just want to know where you and your team were after doing these experiments in terms of how you viewed virology. I think those friends of yours that are virologists better think of a different specialty, because they can make an incredible contribution to the world, but they're going to have to change their specialty.
That's it. Well, you know, I see a lot of people that are, you know, waking up and making that move and making that change, you know, to doing, you know, just in a small way of you know, the project that I'm running. I'm seeing people in general are, you know, the vast majority of people are well-intentioned, and you know, once they have something explained, there's a lot of cognitive dissonance with it. You know, with these large-scale, you know, what I call hoaxes, there is a lot of cognitive dissonance that goes on, because they're huge. You know, a worldview that changes, and so it's just incumbent on people to just move through things logically, and put everything on the table and question everything as being legitimate, you know, especially with things like viruses, because you can't see them. You know, you can't see them in the air. They are you have to trust the experts that what is happening, you know, is happening. And and so like we said at the start of this, you know, with bacteria, it is possible to see them, you know, with a light microscope. Yet with the virus, it's not.
A couple of things, you know, in the, you know, remaining time that we have with you tonight, and I really appreciate if you come back. You've laid a beautiful foundation to understand the work that you've done, and so I think people will be really now better prepared to see what you call the evidence and all this. Couple of things. One was, you said we have evidence that the PCR is not diagnostic. Could you speak a little bit to that? And then I know you have wonderful slides and demonstrations. We're going to see most of them in your next interview. But there was also, in addition to the PCR evidence that it's not diagnostic, people might appreciate a little bit of explanation as to, you know, to prep them for when you bring that evidence, if you want to show anything. Let's do that. And
Well, you know, the PCR work that I have at the moment is I'm not releasing that to the public.
Okay.
I'm working on some pretty high level stuff at the moment behind the scenes to get it verified, because we verified our initial findings with the isolation, so it would be good to verify them independently again, because I think that once you have the results of that type of magnitude, it's best to do it with a name, you know, because I know how it operates. You know, my name will be dragged through the mud. It's got, you know, the fact that I have no credentials, the fact that it's not peer reviewed. We know how it all operates like that. But what I can tell you is that the PCR test, to me, ironically enough, does seem to tell that you're sick, right? It seems to tell you that because it correlates with sickness in general. You know, there were lots of, asymptomatic things, going on in 2020 that were going around where, the primers and, they juiced the PCR to the point where they used it inaccurately and they were boosting the numbers. So you've probably heard the claim about cycle threshold,
Right.
CT. So there's a 40 CT cycle threshold, and you use a machine inaccurately, and it gives you inaccurate answers. But what we've found is a whole lot worse than that. Is that it's not measuring what it claims to measure. So that's really all I can say at
that's okay. Well, it's a good cliffhanger. We'll be, when you're ready and you and your team are ready to put out that evidence, it's going to be fascinating, but it's going to be a great way to substantiate what Dr. Mullis, the inventor, said. He pretty much explained it, but I thought you just did a little more clear version of it. But he basically said you can find basically anything in there, and you can find multiples of things, but it's not going to tell you what you're sick from, or that you're sick with a flu, or that kind of thing. So that's going to be very helpful in the work that you're doing. The other thing is, I don't know if you wanted to share there was one slide that we talked about.
Yeah. So if you get the slide up on the screen and
Sure.
you can have a look at the particle that we found. So this for me is the real kind of visceral part to the experiments. Is actually looking at microscopy. We were talking about the fact that you can see bacteria with a light microscope, but with a virus, they say that it's nanometers in scale. So it's a very, very tiny thing that you coincidentally can only see with a transmission electron microscope. Very, very powerful microscope, and you have to kill the cells. So you have to kill and fix them in a pretty noxious substance to be able to image them. And so any of the claims that you can see viruses hijacking a cell by proxy have to be an imagination. You cannot see with a microscope a virus particle size moving into a cell, because you have to kill them. It has to be a stationary photograph.
I see. Okay.
So in our experiments, we have taken clinical cell lines that we were talking about before, and these are guaranteed sterile. So these are guaranteed when you buy them from an accredited bank called the ATCC. They are given to you as, this is a clean sample. We've guaranteed that there's no viruses in, there's no contamination, there's nothing in these. These are used in all clinical research. And so we took those and we did the cell culture isolation, but with no added sample to it. And then we took microscope pictures of them. And funnily enough, what did we find? Well, we found the exact particles that look like SARS-CoV-2, that look like HIV, and that look like measles.
Okay, by what metric? But by the cartoons? I don't get
So
it.
the metric that the CDC and the NIH give of what these exact particles look like. So if you look at the image on the top,
okay.
we'll start on the bottom. The bottom is what the CDC claim is SARS-CoV-2.
Okay.
So here you can see that it's round, it has these inclusions, and the size. The size is a big giveaway because it's a very, very specific size. So it's 60 to 140 nanometers in size. And in the culture at the top is our pictures that we conducted with a microscopy lab. And there we put an arrow towards an identical particle. So it's round. It has all of those kind of protein inclusions. It has the coat around the outside, and we've put the bar graph up against it, and we have an exact size. So that's probably about 100 nanometers, which is right in the middle of where a SARS-CoV-2 particle should be. And we also have the images of HIV. We have the images of measles. And actually in our latest laboratory experiments, we've found maybe 5 or 6 more varieties. Ebola, we found, which is a very kind of stringy, kind of almost snake-like particle that is it's just the cell lines breaking down. The cells break down, and it's more like a Rorschach graph. I don't know if you know the Rorschach, where it's like an ink blot test.
Yeah. I must interject with a couple of questions. They might be stupid.
Yeah, please.
But could the Ebola with the stringy, I mean, there's a whole issue around parasites and the role that they play, that they are the viruses. Number one. Number two, I don't want to confuse the audience. On the upper picture here, it has that disc, and you've labeled it SARS-CoV-2, but that doesn't exist. You're saying that's what they claim it was, and you proved...
That's what they claim. So in the top, just to make perfectly sure, in the top, it is not possible for a virus to be in that top image.
But they claimed it was.
It's not possible. It's literally, according to scientists in clinical research, it's not possible for a virus to be in there. Okay. Yet we've found the particles that look identical to what they're claiming are viruses. So what they're doing is that they have these cells, and the cells break down, and the cells have a lipid outer layer, a kind of fat outer layer. And when they die, all of the interior of the cell line just blobs out, a bit like a lava lamp. It goes,
okay.
And a virologist will point at the little blobs on the outside, and they'll go, oh, that's SARS-CoV-2. Oh, that's measles. Oh, that's HIV.
Right.
And so we're showing that actually they're just misinterpreting and mislabeling what is cellular debris. That's all it is. The whole thing.
They're imposters. Jamie, you're saying they're cellular imposters.
That's right.
Got a new phrase. They're cell imposters. Well, they've done a lot of cartoons, right? The colored cartoons with the spikes and all that. This is what you're showing is at the nanometer level, the fraud.
Exactly. And this is the problem is that most people think that they don't have access to this type of equipment. And so, what I'm saying is twofold is that actually you do have access to this equipment. You've just got to know, and you've got to be able to be enthralled and and motivated to do it. Yeah. But apart from that, you do have access to be able to check and verify what these people are saying, because I want you to check and verify what I'm saying too. Mm-hmm. And actually in our latest experiments, I worked with a guy called Albert Matthews who said to me, I've seen your experiments and I think that they're great and I think that I believe them, but honestly, I want to see for myself too. And all respect to him, because he went out and did exactly the same thing. And we found even more. We verified our results, and we found the same. We found all of these types of things. So, I think that it's incumbent on people to look, but, this was the problem that we came up against, is the fact that because it's on such a nanometer scale, because it's on, it's invisible to the layman, it's invisible to the general public. You can't just take a microscope off the shelf. You can't go to Walmart and just buy a microscope and see these things because they're claiming that they're too small. Mm-hmm. You have to go through all of these laborious, things to be able to zoom in and go, oh, well, actually, they're talking crap.
Mm-hmm. Actually, that's, and they know that. They know that.
Yes,
that's why viruses have given the powers that be so much ability to dupe and fraud and murder and maim. So, Jamie, we're going to wrap up for this session. I'm so glad I had you. I knew the minute I started to see your work, and I didn't even understand all of it. I understand a lot more of it now that you've kind of walked us through it. It's fascinating. I want to make sure that people can get to your work, can get to because you are trying to get it out on social media. You tell us where to find you, Substack, X, and we'll put it on the screen and people can find you. I'll also put it in the links.
All of the results that we have are being released open source, so you can take those results and use them as yourself. You don't even need to kind of quote me or need to do anything with them. Please repackage them, take them and do what you will. There are lots of people out there that are submitting them to local courts and local jurisdictions, challenging people with these results. So, going and saying, look, can you show me evidence that you've based, local communities where you can take them in. So that's all being released open source on Substack, which is substack.com/control studies. And then I'm also on Twitter. You can just ask me any question about these. I'll be happy to talk to you a little bit more in detail about them. I'm at Jamie. I'm at Jamie A again. Okay. Because I've had so many accounts banned on there through shock horror. I think I'm on my kind of 4th or 5th iteration on there. But
wow, so you're not just a Johnny come lately. You've been at this for a while, and they've been holding you down. And we have the Twitter handle and the Substack on the screen. In fact, we'll make sure it's on the screen throughout the entire show.
Thank you.
For later, but I wanted to make sure we mentioned that people can. And I wanted to add just one more point. I really want to let the audience needs to understand that real science is not afraid to be replicated. And not only are you're encouraging it, you're sharing everything so that others can replicate it, and that's what's been missing. In this whole fraud.
No, thank you. No, it's been out for, the initial experiments have been out for 18 months now. And I have put a call to action for virologists that want to, show that we're wrong, to please do it. And it's very easy for them. It's cost in the region of, $25,000 to put these few experiments together. But for a virologist, it's like reaching into the store cupboard. Okay. For them, if they have a laboratory, it's like reaching in and pulling out a stapler and a pencil and a pad of paper, and they can do it in a couple of days. But funnily enough, they refuse to do it and show that we're wrong. So, there has to come a point where, maybe we're onto something. But as you say, we put everything on the table, and we're open to being showed that we're wrong, and we're open to being verified or falsified.
And see, that's what's been missing. And anyone who refuses or turns you down or scoffs at replicating it is really self-serving. They're trying to preserve their paycheck. Once again, it's always the paycheck. It's absolutely amazing. I want to give you a few minutes. Do you want to wrap up? Is there anything you want the audience to know? Let's do a wrap up, and then we'll look forward to seeing you maybe in a couple of weeks. That would be great.
Great. So I've released the second cell culture experiments. That was done with Virüs cells. So the first ones we did a kind of non-specific control study. The more recent ones have been exactly specific to SARS-CoV-2. So we followed the exact protocol of SARS-CoV-2 and showed that there were showed that the isolation protocol was fraudulent. I will be releasing. So we did a microscope session this time. We kind of went further. We did a 2-hour microscope session. So there's actually a video. And by the way, we videoed all of the experiments in the first experiment. We actually went inside the lab and we videotaped the scientists doing the experiments, so you can see them pipetting all of the substances. You can see them putting it in an incubator. You can see them using the centrifuge. All of that information is up there. We've had to hide the name of the laboratory because there are some pretty horrible people out there who don't like the science that we're doing and want to dox people and want to, put in jeopardy these independent labs that we used. These people were blinded to the outcomes, so they don't know what they're doing. They don't know that they are refuting virology. So we want to protect their professions. Sure. And so we went that extra mile to actually say, look, we're going to protect their anonymity because ultimately you don't need to know their name. Yeah. But we are going to show you that this is legitimate. And it did happen, because I have had some people that have kind of said, oh, you're just making it up. This didn't actually happen. But we've showed you, unless it's some pretty decent Hollywood CGI or something like that. It did happen, and we have videoed and documented it all, and it's all out there. I've put it all up on the Substack, and we'll be putting up a 2-hour a session where we actually go in and look through the microscope. It was done in a very reputable organization, and we look at every single part of this cell line, and you get a real kind of sense of it, the physicality of what's occurring there. And so when it comes to the genetics part, when it comes to the PCR part, there's a lot of work going on in background. I'm looking for scientists. So if there is anybody out there that is an accredited geneticist that is looking to put stuff on the table and have a look at this PCR work that we have, the sooner I can work with people that want to verify or falsify, the sooner we can kind of release that information. So if it's kind of a call to action, if there are genuine geneticists out there that want to do something for humanity, maybe you're having a bit of a crisis, that maybe it's not all what it's cracked up to be, because it's difficult as a geneticist. If we're right, if the information that we have we're right, your job is so
it's limited anyway.
Is limited. So I understand why a lot of geneticists don't want to look at it, because it ruins their worldview. But if you're having a bit of a crisis of confidence, and maybe you've had a long tenured career and you're looking for a career change or something, but you're willing to kind of put your name to it and put it above board, then we can get this. Then we can get these results out there.
Okay, and so people can, if they are interested in their scientists, they want to work with you, they can reach to you through the Substack.
They can reach me Substack, DM me on Twitter, or
DM on Twitter for more privacy. Okay, Jamie, thank you so much. I don't know who your team is and what part of the world they're in, but I hope they see the show, and extend thanks to them on behalf of all of us for the work that you're doing. It's incredible, and I'm really grateful that you're here. We'll
thank you, Dr. Ruby. Thank you for having me on and giving me the platform to tell everybody about it. Thank you so much.
It's my honor, and promise me you'll come back. We'll offline. We'll get another date on the calendar for part 2 and more deep dive into the evidence. Okay, sounds good. Thanks a lot, Jamie.
Thank you.
Well, that's it for this edition of the Dr. Jane Ruby Show. What a great presentation. And how fascinating is that? It's got ramifications that are huge in terms of what is the potential to shut this down. We can't get in one door, we'll get in another. God bless Jamie Andrews. Thanks for being here tonight. Don't forget to follow me on Twitter and Telegram. And I'll see you next time for the Dr. Jane Ruby Show. Have a good night.